There's a young lady in pink. Vasila, can you get him?
Assalamu alaikum, sir.
Sit, whatever.
Assalamu alaikum, sir. I'm Vasila Kakar from Sheen, Balochistan.
Oh, did you go?
No.
I'm a fourth-year medical student here. First of all, I would like to express my gratitude for your presence here. It's truly an honor to have you address us. So my question is basically on the healthcare situation of Quetta. I know this topic has been brought on multiple occasions, but I think so it never got the required attention. So as we know, there was a recent outbreak of Congo virus in Quetta, and 12 or more healthcare workers of ours got infected, and unfortunately we lost few of them. And if I recall properly, there was a similar outbreak that happened in 2011.
Yeah, carry on.
And we lost 2 of our healthcare workers. So fast forward 12 years, and instead our healthcare to get to better or even remain stable, it has even gotten worse. So even during this recent outbreak, there was lack of necessary facilities to prevent the spread, to treat those affected individuals. We even didn't have the required timely availability of air ambulances and other facilities to shift those critical patients to a better tertiary care hospital in Karachi. And if it was there, maybe we would have saved those lives. So my question is, what are your plans, or what is the government planning to do about it? Or is this topic will be kept aside as it has been the case in the past? Thank you.
First of all, I'm so glad to see you, hailing from Pishin, from the same tribe, and you are having quite a remarkable contribution over here, and I'm very proud of that. Keep doing the good job, and inshallah we'll have a hospital in Quetta one day under your leadership. These are the challenges of the governance which we need to understand. You know, there was a political discourse for last many years and for almost many decades, if I would say it, that all the provinces wanted more autonomy. And as a result of that, 2008, we get 18th Amendment and the financial and political power that are transferred to the provinces. With a caveat that after that it had to be followed by a provincial finance commission. The process halted there, and we got an NFC. The 18th Amendment is there. The concurrent list from the federal government was diluted, and now all the provinces have got their more political and financial powers. And health is a devolved subject. Now when health is a devolved subject, what do? You can, well, of course, federal government to an extent can play some role, but when you have given all the money to the province, it is now their discretion that how do they spend it. I'm saying this with pain. I'm not enjoying it. I don't blot over. The kind of capacity we have at the provinces, particularly political and bureaucratic, is part of the problem. Is part of the problem. You do not see any kind of visionary leadership either in bureaucracy or in political class. So where is the planning section? I mean, you have got a hospital in the heart of the town, which is what, more than 100 years old almost. It was constructed somewhere in 1920s or 1930s, early 1930s, for the population of 8,000 to 9,000 people. And now the documented, according to the census, it's 3 million plus population, and the conservative estimate, which is not non-documented, I think so, the population is more than 5 million. And the same hospital is providing services, and with this devolution of the power, there is no vision how to magnify, how to amplify the services which is the need of the population. You're talking about the subspecialties and the rest of the ideas associated with it. We do not even have sense of basic health care. How do we do that? And One challenge is there's a scarcity of resource. The other is mismanagement of resource. We need 1,000 rupees, but we've got 100 rupees. And I mismanage those 100 rupees too. So that is the challenge. What do we do with that? It is directly related to our political system, our governance systems. As an individual, after 2 months when I would be retiring from this stint, how much I can do, it would be mere rhetorics or shallow